What is a sputum smear for TB? Have you ever wondered how doctors diagnose tuberculosis? One of the key tests they use is called a sputum smear. This test helps detect the presence of tuberculosis bacteria in sputum, which is the mucus and saliva that comes from deep inside the lungs. It is a primary method for diagnosing active pulmonary tuberculosis, especially in areas where the disease is most common. The process starts with collecting sputum samples from a person suspected of having tuberculosis. Typically, 2 or 3 samples are collected. The sputum is then spread thinly on a glass slide, stained with special dyes, and examined under a microscope. The goal is to identify acid-fast bacilli, the bacteria responsible for tuberculosis. If these bacteria are found, the test is considered smear positive, indicating that the person has an active tuberculosis infection and may be infectious to others. One of the reasons sputum smear microscopy is widely used is that it is simple, quick, and cost-effective. It can be performed in basic laboratory settings, making it accessible in many parts of the world. When done correctly onto consecutive sputum specimens, this test can detect 95 to 98% of smear-positive tuberculosis cases. This high sensitivity makes it an effective tool for identifying infectious patients and starting treatment promptly to help reduce the spread of the disease. However, it is important to note that sputum smear microscopy has its limitations. It may not be as sensitive in cases where the bacterial load is low, such as in individuals living with HIV/AIDS, children, or those with extrapulmonary tuberculosis, which occurs outside the lungs. Additionally, this test does not provide information about drug resistance. Because of these limitations, newer diagnostic tests, such as molecular assays and culture methods, are often used alongside smear microscopy to improve overall diagnostic accuracy. For the sputum smear test to be accurate, the sputum must come from deep within the lungs and not just saliva from the mouth. Patients are usually advised to cough deeply to produce thick, sticky sputum. In some cases, steam inhalation can help loosen sputum if coughing is challenging. In summary, a sputum smear for tuberculosis is a vital diagnostic procedure that involves examining lung sputum under a microscope to detect tuberculosis bacteria. It remains a cornerstone of tuberculosis diagnosis worldwide due to its practicality and ability to quickly identify the most infectious cases, although it is often complemented by other tests to enhance diagnostic accuracy. If you suspect you have tuberculosis or have been exposed to it, it is always best to consult a healthcare professional for personalized advice and testing.